Gregory Johnson. We have Angel here with us today, and he flew all the way here to Houston from watching our YouTube videos from Los Angeles, and he's here for 2 days to see us, right? You
Yes,
came
sir.
here specifically for that.
Yes, sir.
Right?
Yes.
So
Houston.
this is his very first visit here today, so we're going to show you what we're going to do to help him out with his hiatal hernia and rib pain and chest pain he's been having from his. So let's take a look in the mirror here first. I'm going to have you flex your head forward and backwards for me, then, Angel. What a great name, too.
Thank you.
Yep. And we just said a healing prayer together with Angel this morning, and that's the way we start our morning every morning. Renee and I pray for healing for every single one of our patients. You a side sleeper most of the time, Angel?
Yes.
Yeah.
Unfortunately.
Okay, so we've got his posture analyzed. Let's go ahead and lay you on your back right here.
Okay.
Put your head up this way. When I lift your leg up, tell me if this creates any pain in your lower back or your leg at all.
No,
Just tightness, okay. And is there any pain anywhere when I do that?
No.
Okay, good. Let's cross this one over. And as I push down here, do you have any hip pain or back pain? Okay, good. He's not really coming in complaining of any lower back complaints or leg pain complaints. However, anything there?
No.
Okay. We want to rule out any pathology or problems that he may have in the area he might not know about. Okay, I'm going to have you lift your head up. Does this cause pain anywhere, Angel? In your chest?
No.
Oh, the upper back right there? Okay, let's check and face Renee this way. So, tell me if this hurts anywhere in your spine.
No, sir.
Okay, I'm going to go backwards and to the right. How about that one?
Yeah,
Right there?
Yeah.
Okay, that's a positive foramen compression. How about that one?
He's still here.
Okay, let's tilt you this way. Does that cause any pain in here or here?
Pulling.
Okay, does this make that worse?
Yes.
Okay, that's positive shoulder depressor test and lateral flexion. Does that hurt over here or here?
No.
How about when I do that?
Just a little
Right
bit.
in there.
Yeah.
Okay, also positive right shoulder depressor. Turn your head left. And now right. Okay, yeah, that's the way you sleep most of the time, huh?
Yeah.
Okay, now I'm going to push down. You hold this up. Good. Okay, same thing here. Hold. Excellent. And I'm going to pull out, resist. Yeah, and I'm going to push in, resist. Excellent. Same thing, I'm going to pull out first. There you go. Now I'm going to push in. Excellent. So he's got 5x5 muscle strength in his biceps, deltoid, and triceps. So we're going to check his reflexes now. Biceps +2. Brachioradialis +2. Triceps +2. Good. Biceps +2 there, 2, 2. So he's equal and active in his upper extremity and his lower extremity. Patellar is good. So is his Achilles on both sides. That's good. So I'm going to have you walk on your tiptoes about 3 steps that way just to make sure you can do it. Now on your heels only, towards me. Yep, good. Now if you were to bend over like you're going to touch the floor, does it hurt anywhere in your spine?
I have great mobility, but just pull a little
Pull
bit.
right in the thoracolumbar area, in that rib, lower rib cage.
Lower rib
Okay,
cage.
how about when you go backwards? Does that hurt anywhere? Same
Just
area?
Same area.
Okay. Okay, let's go on your tongue here now. Angel injured his lower rib cage and tore the cartilaginous ribs that attach to the sternum, which is the bottom 4 ribs that attach to the sternum down here, and that's what the diaphragm attaches to. That's tender right there, huh?
Yeah.
Real bad. And right there as well.
Oh, yeah.
Now see, his right leg is short by a ½ an inch, and I'm looking right where his sole meets his heel, not on the bottom of his heel. So yes, you can check the legs with shoes on, and that tightens up in the lower back right there. Did you feel that?
Yes, sir.
And then he's got L5 out right there. He's got bilateral muscle hypertonicity, but it's worse on the right side, all the way up here, huh?
Yeah.
Oh, that's tender right there too. You got some knots in your rhomboids here, trapezius. Okay, there we go. Ooh, that's real tender right there. When you get headaches, do they start right in here?
Oh, yeah.
Yeah. Okay, right there too. That whole right side of your neck's a mess. Okay, so this is his very first adjustment here at Advanced Chiropractic Relief. So we're going to adjust his SI joints first. Getting his left one now. And then his sacrum on the right. Right there was sticking out more posterior right on the sacrum. L5, we're dropping straight posterior to anterior in the Z-axis. That was L4, L3, L2. I'm sure all these are a little sore. And L1. Now, oh, you're out for me. That's already moving. Look at that. Do you feel that?
Yeah.
There we go. Perfect. Excellent. It's gonna be tight in some areas. I'm doing some oblique lateral stretch down in his lumbar spine, but all the way up into his thoracic spine. He's really tight right now. Okay, his legs are exactly even now, and is this feeling easier this time, Angel?
Yes, sir.
Okay, good. Now, I don't normally do this, but I'm going to go ahead and do a lateral posture adjustment on his pelvis because he's got some... Okay, let's turn you on your right side, Angel, towards me. He has some fixation going on down in his pelvis here, so to break loose some of the fibrotic adhesions that develop down in that region, could just let this all relax. That's perfect. Good job. Now let's turn the other side up. So you see, I do know how to do these, although I don't like to do them frequently because they do cause ligaments instability if done too much. Okay. There it is. Good. Okay, now let's go on your back. Okay. Just lay your head right in my hands here. That's it. There's the good old Palmer diversified cervical adjustment. And hopefully I wasn't talking too loud on that one for you crack addicts out there. We have a lot of fans that are what they call themselves crack addicts, meaning they like to hear the noises when I adjust, which is cavitation. That's where nitrogen gas inside the synovial joints just pops when I move. You should have felt that in your knee and your back, did you?
Yes, sir.
Okay, good. Now, let's slide you back up that way just a little bit. Okay, so I'm going to get on his stomach here. I'm going to grab the stomach right here. Ooh, boy, did you feel that? That little pop right there at first? There it is. Okay, another one. There you go. His is actually a little bit harder and tighter than the last few patients that we've seen with hiatal hernia that's flown into Houston for care. We literally do have people from all over the world flying in here for treatment, just like Angel did. He's from LA, so he's still in the US, but we have several patients that have come here from LA. Yeah. Usually the ileocecal valve will be tender whenever you have hiatal hernia as well as this valve on the right side between the colon and the rectum. Right there, is that tender as well?
Yes, sir.
Okay, now let's slide you down on the table, Angel, where your feet are hanging over. There you go, perfect. Yep, see, he already knows what to do. He's watched every one of our YouTube videos.
Yes, sir.
There we go. I'm adjusting his anterior rib cage now. He's probably going to be pretty sore here because of the injury that he sustained, as well as him being out of place in so many areas through his thoracic spine. Okay, his rib cage is pretty even right now. Good. Okay, let's sit you up and face towards Renee for just a moment. There we go. There we go. Okay, look straight ahead for me. There you go. Now, he's had some problems with this shoulder blade area over here too, so we're going to decompress him here in a second to show you his very first manual spinal decompression as well. Whenever you pinch the nerves out of the cervical brachial area up here in the lower neck and upper thoracic, sometimes you'll get numbness and tingling into the shoulder and the arms all the way down into the hands and fingers. And you've experienced that too, right, Angel? There we go. Yeah, very good. Okay.
Were you going to decompress him?
I am. Yeah, let's decompress him first. Thank God for Renee. A little on autopilot here this morning. It's Monday here in Houston. Well, at least you missed the weather. The bad weather.
It's kind of gloomy out
Yeah,
today,
it's
though.
gloomy. Did you fly in this morning or yesterday?
I got here yesterday.
Yeah, it was nice out yesterday.
Yeah, it was beautiful yesterday.
Yeah. So I'm going to raise these legs up parallel with the floor. There we go. Good. Does that feel a little more relaxed down there for you? Good. Okay, so I'm going to get my cold, wet towel here and wrap it up. And I use a cold, wet towel for those of you who hadn't seen it on my first 150 times I've talked about this, so that I can get a better grip on his occiput and his mandible. There you go. Now, nice deep breath in. Let it all out. Oh, yeah. Woo, baby. That was the ring dinger.
Yeah.
There we go. You feel that all the way down, Angel?
Oh, yeah.
And he's still kicking. All right. Very good. Now we're going to shoot you.
You did
Now let
good.
you tell everybody how you felt on that first. You're probably going to feel pretty light when you stand up. Okay, let's turn sideways. Let me help you sideways. There you go. Good. And let's come over here in front of the mirror now.
Felt taller.
Yeah, it's taller actually. Okay, let's have you flex your head forward and then backwards again. Alright, so we've already improved his posture and range of motion, so we're going to show him that's what you should do right there, up and back. Flare these guys way back. You might want to spread your feet a little bit further apart. Then we're going to bring your head straight back this way, and because you're translated a little bit that way, we're going to tilt that way. Shift your pelvis straight left now. Hold that right there. Okay, you can relax. Let's try that same thing again. And neutral. How'd that feel compared to the first time?
Really
A
smooth.
little smoother? Good. I think I knocked your earring in. Here, stop, fall. Oh, here you go. There we go.
Thank you.
Good. So, Angel, would you mind telling our YouTube subscribers and watchers, you came all the way from LA here for
Yes,
this?
came all the way from Los Angeles just for Gregory Johnson. Astronomical, experience. Very smooth. Doesn't hurt, surprisingly.
And I got pretty deep in there, too.
Yeah, I feel way better. My back, I can feel straighter. I feel taller, easier to breathe.
And praise the Lord. And we're happy to have you here,
Thank
and
you.
thank you for sharing your story with us.
Thank you.
And this is your Houston Chiropractor, Dr. Gregory Johnson at Advanced Chiropractic Relief in Houston, Texas. We'll see you next time.